Hello, School of Nursing students registered in the following programs below. Either you are full-time or continuing education nursing student. This tutorial video will help and teach you the step-by-step instructions in how to double-check over your specific program health form documents before you finalize your submission and pay for the initial submission fee to the ParaMed Placement Pass portal, and to receive a ParaMed clearance stamp and be eligible for your upcoming clinical placement. I'm using the Practical Nursing Program Health Form as an example for you. Step 1, please make sure that you fill out and complete all of the top portion of the forms with your personal information. Anything that you see with your name and ID in all of the pages of the form. You also need to fill out the agreement forms on the last pages. Step 2, tetanus, diphtheria, and pertussis shot. Please make sure that your Tdap shot is valid within 10 years, and your doctor document the date on the form and attach any proof of immunization record or yellow card. If this section is blank or missing, please follow up with your doctor's office to correct the information on the health form before you submit and upload it to the ParaMed portal. Otherwise, you will not receive a clearance stamp from ParaMed and you will pay a resubmission fee. For polio shot, this requirement is for our S118 BSCN collaborative nursing students only. Your polio shot is valid once in a lifetime. Please make sure that your doctor document the date as well on the form and attach any proof of immunization record, either from your public health or a yellow card. Please follow up with your doctor and correct the information on the health form before you submit and upload it to the ParaMed portal. Otherwise, you will not receive a clearance stamp from ParaMed and you will pay a resubmission fee. COVID-19 vaccine. Please make sure that your doctor document the dates and attach proof of QR code or any type of vaccination records. If this section is blank or missing, please follow up with your doctor's office to correct the information on the health form before you submit and upload it to the ParaMed portal. Otherwise, you will not receive a clearance stamp. Seasonal flu shot is mandatory or strongly recommended. Please don't worry about the flu shot right now. You may submit the flu shot record in November, December to your ParaMed portal account. Measles, mumps, and rubella. If you are submitting proof of previous 2 doses, please make sure that your doctor document the dates on the form, and you must attach proof of immunization record as well that you need to submit and upload to the ParaMed portal. If this section is blank or missing, please follow up with your doctor's office to correct the information on the health form before you submit and upload it to the ParaMed portal. Otherwise, you will not receive a clearance stamp from ParaMed and you will pay a resubmission fee. If you are submitting proof of your laboratory evidence of immunity, or blood test report, please make sure that you have a copy of your lab test reports. And if the result is reactive, it's mandatory that your doctor check the box here, and this is done. If you are submitting a copy of your blood test report with non-reactive, non-immune, or negative result, please make sure that your doctor checked the boxes on the form and ask them to document any previous doses or new doses on the health form. Please varicella or chickenpox. If you're submitting proof of previous 2 doses, please make sure that your doctor document the dates on the form, and you must attach proof of immunization record or yellow card. If this section is blank or missing, please follow up with your doctor's office to correct the information on the health form before you submit and upload it to the ParaMed portal. Otherwise, you will not receive a clearance stamp from ParaMed, and you will pay a resubmission fee. If you are submitting proof of laboratory evidence of immunity or blood test report, please make sure that you receive a copy from your doctor's office, and it's mandatory that they check the box on the form. And this is done. If you are submitting blood test report with non-reactive, non-immune, or negative result, please make sure that your doctor document any previous doses or new booster shots on the health form. Hepatitis B. If you are submitting proof of immune, reactive, or positive blood test reports, it's mandatory that your doctor check the box on the form and give you a copy of the blood test report. And this is done. If you're submitting a copy of your blood test report with non-immune, non-reactive, or negative result, please make sure that your doctor checked the box on the form and document any previous or new doses on your health form. 2 consecutive step TB skin tests. If you are submitting a brand new 2-step TB skin test and the result was both negative or less than 10 millimeters, then your form should look like this. Please note that you cannot leave this section blank, and your doctor has to document all the skin test dates, all the reading dates, and the duration size on your health form. If you had proof of previous 2-step TB skin test and the result was both negative, then your form should look like this, and you are required to renew a step 1 TB skin test only. If you had proof of previous 2-step TB skin test or 1-step TB skin test and the result was positive right away or more than 10 millimeters, then your form should look like this, and make sure that your doctor answers the TB questions, do an annual physical exam, and answer the TB questions below, and you must attach proof of chest x-ray report. Please make sure that your health form documents has an official signature from your doctor with the date and their medical office stamp on page 3 and page 4 of your health form. If you're missing a stamp or signature from your doctor, you will not receive a clearance from ParaMed. Let's move on to the additional requirements section of your form in double checking the non-medical certificates. Vulnerable sector check. Please make sure that you receive your vulnerable sector check record by the given deadline and attach a copy of your vulnerable sector search, depending on your regional police. If you live in Toronto, your vulnerable sector should look like this, and whatever the issue date, that's valid either 1 year or every 6 months, depending on your program. And if you live in other region, there are different types of regional police services format with the vulnerable sector check. And write down the issued and expiry date on the form. Standard first aid and basic life support certificates for the practical nursing, S121, S118, BSEN, and C112 PSW students. You must have a standard first aid and BLS support certificate. Please make sure that you download this certificate and your standard first aid is valid for 3 years. And your basic life support certificate must be added to your submission to ParaMed, and it's valid 1 year after the issue date. For our perinatal, perioperative, and consolidation clinical practice students, you are only required to have a basic life support certificate, okay? And it's valid for our perinatal and preoperative students. It's valid for you every 2 years. And for our nursing consolidation students here, it's only valid 1 year after the issue date. Mass fit test. Your mass fit test certificate must be valid every 2 years, and you also need to submit a copy of your certificate. Document the dates on the form. Once you have everything completed, your final step is to create an account, submit, and upload your documents to the ParaMed Placement Pass portal. For more information in how to submit, upload, and pay to the ParaMed Placement Pass website, check our ParaMed tutorial video